You've probably heard of an echocardiogram before, but did you know that it's a type of ultrasound test? Dr. Gary Allen, Medical Director for Cardiothoracic Surgery at Florida Hospital Waterman, explains how echoes are a powerful diagnostic tool.
As far as diagnostic testing, it starts with some of the baseline studies, things like an EKG, chest x-ray, blood tests, blood pressure, and then history and physical to take a look for signs and symptoms of cardiac disease. If there are any concerns on that level of testing, the next level of testing generally includes things like an echocardiogram and then some type of stress test. 3D echo technology has been around for a handful of years now and is becoming an evolving standard in cardiac disease. We certainly all understand that the heart's a three-dimensional object, but up until recently it was always viewed in 2 dimensions on a flat screen. 3D echocardiography allows us to have that 3-dimensional view of the heart. It allows for better diagnosis of different diseases. The earlier diagnosis of cardiac disease is really what I would call a polarizing event in medical care. Certainly technology continues to evolve and it becomes more and more onerous on behalf of the physicians to try to understand what are helpful standards and what are just add-on technologies that don't seem to add very much. On the other hand, you have a population base who is becoming more educated about what is available to them and trying to understand, how those needs meet. Certainly what we've established, which is true of any good screening program, that earlier detection leads to better outcomes. And if you take a look at a broad view of society, really we should all start getting screened at about the age of 40.
You'll find more information about Dr. Allen, the staff, and procedures offered at the Waterman Heart Center on our homepage at yourhometownhealth.com.